Welcome, Dr. Adusi Poku.
Thank you very much, Kachi, and thank you, everybody. I want to say, and I'm very happy to say that Ghana was a pioneer in Delft imaging and CAT for TB use. And this has gone a long way to help Ghana. So please, next slide. It's about using the digital X-ray and CAT for TB in vulnerable groups. One of them I want to say is at the ART centers. So how did we begin? Ghana began the TB preventive therapy policy introduction late, but with the introduction of the digital X-ray, we were better equipped to introduce TPT, and I will show you with results. Please, next slide. Right. So we had the better capacity to exclude active TB. And so we decided to introduce the TPT at programmatic level. So in 2021, we developed our TPT guidelines, which we adapted from WHO. And then we piloted this in 10 regional hospitals in 2020 before scale up at the national level. This was a collaboration between the Ghana Health Service, Aurum Institute, who provided with the medicines, WHO Ghana Country Office, and the West African Regional Network of Tuberculosis Scientists, of course, using the Delft Digital X-ray with CAT. Please, next slide. So the policy highlights were this, that one, we will incorporate our standard operating procedures. We will incorporate digital X-rays as well as symptom screening tool. We will also have eligibility criteria. We will have treatment options. At that time, we started with isoniazid, and then we tailed it off and then introduced 3HP. We will also monitor adherence, adverse events, and treatment completion. Next slide, please. Right. So on my left is our algorithm. Okay, we have algorithm for facility-based, and there's one also for the ART, and then contact tracing. On my right is the symptom screening tool that we have. The next slide, please. Okay, so following the pilot study, we were going to scale up in 16 regions in 261 districts, beginning from facilities. Next slide. Right, so we use our digital X-rays with CAT, and I must say that it came handy. There were some trainings for GPs, general practitioners, on how to marry X-rays with the history and also taking samples for testing, spitting samples for testing. Please, next slide. Okay. So the aim was of the pilot at that time was to do systematic screening of TB among patients living with HIVs. We have the containerized. We also have later on, we got the Delft lights at the back that we put at our back and go to the communities. We also have the housed one. So the second aim was to conduct the feasibility of initiating of PLHIV without active TB on TB preventive therapy. Please, next slide. Right, so the first speaker mentioned those who were asymptomatic. For us, the TB yield was 2%, and those asymptomatic, just using X-ray alone, was 26%. Okay, and then we have the clinically diagnosed 72% and bacteriologically confirmed 28%. Of course, the WHO, we don't need X-rays as a place for introducing TB preventive therapy. But this is the result staring at us, which means that with the introduction of digital X-ray, it goes a long way to help the country. Please, next slide. So we scale up this in 2020 to include contact of TB patients. We had to build capacity at that time virtually because of the impact of COVID. And then we introduced the 3HP alongside the isoniazid. And then we fully transited from isoniazid to 3HP. Next slide. Right. So if you come to the new HIV clients, you see the results, which we are trying to improve on it, but this is the results staring at us. Next slide, please. And then we come to the TPT enrollment among contacts, PLHIV contacts, okay. And so here we are also indicating that the contact enrolled on TPT was 43.48% with a new HIV client on TPT. Okay, that goes for 30%. We are trying to improve on it, but it's kind of put this in context over. Please go on. So we had challenges. One of the challenges is that we have 71 digital X-rays compared to 261 districts. Okay, we also have challenges with data capture. And then, so from there, we have placed these digital X-rays in high volume sites. However, we have a strategy. Next slide, please. So the strategy in 2024, next slide, please, is to introduce the concept of hotspots. What do I mean by the concept of hotspots? The digital X-rays are not everywhere with CAD. If you take Ashanti region, for instance, Ashanti region has slums, also has prisons, the second largest prisons, also has mining communities. They have hard to reach areas. We are working with NGOs. We have what we call the government side community health planning and services. We have mapped all this. What we will do is to move our digital X-rays and advance into this Ashanti region. We make sure at the facility level, we register all those who need X-rays, contact investigations, we register them, which means that we have to have very good address system. And then we also visit the prisons and screen them. Mining areas, we screen both with the digital X-ray and the symptom screening, and then we come out. This is the concept of hotspot screening, targeted hotspot screening, using epidemiology to guide us in terms of the communities with high number of cases coming, what is the community population, and then we derive proportions. Next slide, please. Right. So we will use the hotspots concept as I've indicated. We will build capacity for our health staff, and then we will improve on our reporting using our e-tracker. Next slide, please. Right. I just want to, on behalf of those who are benefited from our X-rays, our symptom screening and our X-rays, and this is what they want to thank you for. You never know your impact until you see the smile of it far away. And the second point is, what is that we are missing in life if those in need cannot access our services? That's why we need some innovations to get our digital X-rays down to those who need it. Next slide. I want to thank the Royal Dutch on behalf of the Director General of Ghana Health Service, the Minister of Health of Ghana Health Service. I want to thank the Royal Dutch government for providing us together with the Ghana government these digital X-rays. Also, the WHO country office the Global Fund, the USAID, the Aurum Institute, Ghana Health Service, Ministry of Health Ghana, and the West African Regional Network of Tuberculosis Patients. I want to thank Delft. Thank you very much.